Hi guys, this is John Adamson, the Rehab Documentation Guru, and today we're going to cover some no-no phrases in documentation. These are not all inclusive. I'll probably do another video at some point covering more no-no phrases, but for now, this is a good place to get started. The first no-no phrase is patient has plateaued. Now you could use this in a discharge summary if the patient is no longer going to be getting treatment. One of the problems I see with documentation by some therapists, though, is that they'll use this phrase when the patient is still getting treatment. You've just told the reviewer you're making absolutely no progress towards your goals anymore, and therefore it should be time to discharge. So try to avoid that phrase. The next no-no phrase that we'll cover is patient is not compliant. In my documentation course, I cover how to deal with non-compliance, but one of the concerns with non-compliance is that it sounds like the patient has not had a right to refuse care or to informed consent. Rather, if the patient is not following directions, not wanting to work on a certain goal, not wanting to participate in therapy that day, we'll document like that. Those kind of statements are fine. But try to avoid the not compliant statement if you can help it. And if I think about it, I'll do another video about that. Patient consistently refusing care. I see some therapists that will document this on a patient on multiple different days. This is a problem because, again, it might be a violation of the patient rights. The patient's decided to exercise their right to refuse, and if you continually offer them services they've said no to, then are you violating their rights as a patient to refuse care? So think about how you can document that more appropriately. Generally, I would just say that the patient has opted to not participate in therapy on this given day. Patient was educated concerning plan of care and participation in goals, and patient has decided no, something to that effect. Now, there's two statements that Medicare specifically states are bad documentation. One is continue per plan of care, because one of the things that Medicare does not pay for is care that is repetitive in nature. And when you continue something, you're repeating something. So avoid that phrase. And again, in my documentation course, I cover what it looks like to adjust a plan of care. And then the other phrase that Medicare is saying no to is patient tolerated treatment well. That is a nebulous, subjective phrase. It means nothing. So if you want to talk about the patient's tolerance to treatment, give specific, measurable, objective measurements, subjective reports, but do not use this catch-all phrase. It's bad documentation. So this is John Adamson, the Rehab Documentation Guru, covering some, but not all, no-no phrases in documentation. If you like this video, please subscribe to my channel. I'll be posting regular content. Also, if you suggest a topic in a comment, I'll be happy to try to cover it in a future video, because that's always fun, and that way I know specifically in the field what you guys are facing for documentation requirements or concerns. Anyway, guys, have a great day. Thanks so much. Bye-bye.